Welcome to Preventive Cardiology and Rehabilitation series. Today we are going to speak about cholesterol and decode it like every Indian family should understand. Joining me today, Dr. Subrahmanya. Welcome sir to the series. So today the first question is that many a time we see that my profiling is normal and all of that, and my father and mother had heart disease and I will definitely get it. Do you think genetic is like you have to accept it as a fate, or is there something which we can do it?
So the first thing that everyone should understand is that yes, there are genetics involved in heart disease. Unfortunately, till now, it is not really clear-cut about what are these genes that cause it and where it is happening and what are the parameters involved. For example, if I were to take my own family history, my father suffered a heart attack at the age of 40, so you would call me high risk, right? But then that doesn't mean that I am bound to get it. The reason is that despite whatever be the genetic risk, it is always important to look at the risk factors. So if I have diabetes, if I am having hypertension, if my cholesterols are raised, if I look after my risk factors, I am more or less safe. The idea of having a significant family history is that I am more careful about myself.
So generally, sir, like whenever people are doing blood test and profiling, they see their total cholesterol and they think that it's normal, so my cholesterols are fine. So can you tell our audience that, which are these tests which we are supposed to do considering when it comes to cholesterol?
So again, like ma'am pointed out, it's now a fad for people to get health checkups done. And more than a fad, yes, it is a reality. But then understanding the results of the health checkup needs professional expertise, needs understanding of your doctors. So you will see a whole bunch of parameters written down in your lipid profile test. And when you look at all of them, the labs, some of them will, even if it is 1 point high, it will be marked red or black. And then people come saying, sir, it's like this. So the thing is, there are a lot of parameters in the cholesterol. It is to understand that most of the labs can only directly measure your total cholesterol and triglyceride. Everything else is actually computed by a formula. So this can vary with your fasting status, with the time it's taken. So it's a very dynamic sort of test. And the most important thing as physicians we are interested in is the HDL and the LDL cholesterols, because these are known to matter for heart disease. I agree many people come with asking us, sir, we have done this ApoB test, we have done this lipoprotein A test, and do these matter? Yes, they matter. They have now been shown to be causing or they are making people at higher risk for heart disease. But then what you all have to understand is these markers do not have any therapy targeted at them at present. So it is something that when you do these tests, it is high. It means that yes, you may have a higher risk of heart disease. Can we treat them? Presently not. What do we have to focus on? Just focus on your LDL and HDL. If these markers are high, it only means you need to be more careful. You need to come for checkups more frequently and look at other things like your treadmill stress tests.
And sir, like you rightly said that, we should see the markers and the values. So if we have to give our audience a cheat sheet and we have to tell them like a cutoff value for all of these, so can you tell is that according to age, or how do we see that we are at risk right now?
So again, that's a very good question by ma'am, and that's a question which most of the patients want to know from you as a physician. But you have to understand one thing, that the cutoff levels for cholesterol, the LDL particularly, are not one size fits all. It depends on the patient's cardiac risk, and doctors have multiple ways of deciding the cutoffs. We have multiple risk scores with which we decide, yes, this is your cutoff level. So for example, if there is a person who has no other risk factors, no family history, even an LDL cholesterol of 160 is acceptable. You don't need to start medication for them. You can suggest them diet or other things, exercise. But a same patient who is diabetic, I would even say bring it down to 110. So it's a very individualized thing. On a rough level, if you have to understand, for a general population, it is good that it should be less than 130. For diabetics, less than 110. If somebody has already suffered a heart attack and has a stent or had a bypass surgery, for them, the cutoff is 70. These are all cutoffs for LDL cholesterol, by the way. And for somebody who has had multiple heart attacks or strokes, for them, some guidelines recommend an LDL cholesterol level of less than 55. But again, I would like to stress that this is an individual decision. which is best made by your treating doctor. So please come with your reports to your local physician or cardiologist and let them make a decision for you.
Yes, sir. And like as you mentioned in middle that diabetes, like what is the role of insulin resistance or diabetes when it comes to cholesterol management? Like why that is important?
So as we have to understand, the cholesterol levels in the body are, and it's a dynamic interplay of multiple factors, including blood sugar levels, including in many times your diet, including many times blood pressure. So in India particularly, we have an obesity pandemic, which is much like the Western world. And as our economy advances, as lifestyles improve, this is going to become a bigger problem. And something called a syndrome X is frequently described, which has a constellation of a patient who is obese, has slightly high blood pressures, and slightly high blood sugars, not exactly to the level we diagnose as diabetes, which we call a metabolic syndrome or a syndrome X. And these people have higher risk of heart disease. And it is in these people that we frequently see the interplay of high blood sugars leading to higher cholesterol. And if you also see the pattern of high cholesterols is different in diabetic patients, they particularly have higher triglycerides along with higher LDL as compared to other patients.
Okay. And sir, like when we decide that this person can manage only with diet and exercise and other things and not required to start any medications, because people nowadays are very hesitant of statins and medications and all of that. So when is the good time and what we should see before starting the medications?
So again, I have pointed out earlier, we must focus on the patient's risk factors and their overall risk. It's again an individualized decision about starting medication. For some people, it's a no-brainer based on their level and based on the LDL level and based on their diabetic status. But the one thing which everyone needs to understand is that statins are very time-tested drugs. They have been now available in the markets for 5 decades. They have come with a wealth of data. Yes, all drugs have side effects. Statins do have side effects, the most common being muscle cramps, but generally they occur earlier in therapy. Some people have often come with a question that, doctor, we have heard that statins can themselves cause diabetes. Yes, that is true, but it happens later in therapy, and the benefit that you get out of this therapy. So even if you get diabetes because of statin, you can always treat it with medication, but you still prevent at least 40-50% your risk of heart attacks reduces. So statins are such powerful drugs, and they make a huge difference to people who really need them. Whether you really need them, again, is individualized based on your risk factors and your LDL cholesterol level. So you must meet your physician once you come with a cholesterol report for them to decide whether you can initially go with other things like exercise, diet, before you go for statin therapy. If you are offered statin therapy, please do not fear it. These are time-tested drugs and they are life-saving for sure. Yes, they have problems, but be in touch with your doctors and they will look after it for sure.
And sir, like in rehab, we many a time see that, after the heart event, they are on statins, and like how we tell our patients that, do not stop your BP medications, do not stop your insulin and all of that. Does that same work for statins? Because I've seen many people just stop taking once their cholesterol profile is normal. So what is your advice on that?
So again, this is a very interesting question which ma'am has asked. And particularly many young patients come with these altered lipid profiles. Somebody would have started a statin and then they'll say, doctor, we'll take it for 3 months. We'll also exercise in the same period. We'll be careful with our diet. And can we stop it after 3 months? So again, my take here is that there is no set guideline or way to say who can stop it. But for sure, those who have higher risk like diabetic patients, those who have already suffered heart attacks, for you, this treatment will last your whole lifelong. There is no second doubt about it. For otherwise healthy, active individuals, yes, it's an individualized choice. If they improve their lifestyle, if they have weight control, and if they are able to look after their diet, surely it can be considered to stop in such patients, but not in those who have other problems like diabetes or those who have suffered heart attacks. For them, it is as important as your blood thinners or aspirin. It goes for life and it will surely protect you from future problems.
So, meeting cardiologist and deciding to stop or continue is the right choice in this matter.
You can meet any of your local physicians or cardiologists, and I'm pretty sure they will give you the right opinion.
And sir, as you mentioned that, about diet and exercise, so many a time we see that, when it comes to diet, people think that, oh, my cholesterol is on a higher side, I'll take care of my diet, I will reduce my oil and I'll be fine. And in rehab, I have also seen that people start taking plant-based, medications and things like that. So what is your take in this? Like, how much diet role is there in cholesterol management?
So, like ma'am has pointed out, the role of diet in cholesterol is very, very important. When I mean very important, it's also the kind of diet we follow. The most important thing that everyone needs to understand is, as Indians, we have an obsession with grain. So, like say I'm a South Indian, and if you see me eating my average meal, you will be scared to see the amount of rice I eat compared to the other things. So, if you take, when I was a student, my roommate was a North Indian, and he used to joke at me, "Arey yaar, tum itna rice kha leta hai," but I would tell him back that, "Arey yaar, tum itne roti kha leta hai." So the problem with us is the amount of grain we consume constitutes a very high level of carbohydrates, which obviously is more in proportion to the other things like the vegetables, the pulses, which give the protein, and even the fat. So if we all know, since our schooling days, we are taught the balanced diet. And when you actually look at the balanced diet, the carbohydrate composition, what we eat is far more than what is recommended. So a simple, easy way to start out is control your grain, improve the amount of vegetables you can add, or even nuts. And for all those of you who are interested in a bit of reading, please consider reading online about something called the Mediterranean diet. So there was a study called PREDIMED, and that study was intended to run for 5 years, and it was intended to compare a regular diet versus an American low-fat diet versus a Mediterranean diet. And the study was terminated earlier in just 2 years because they found that there was so much benefit with the Mediterranean diet that it was unethical to let other people suffer the consequences of the diet they were being tested on. And all it included was some extra nuts and olive oil in its virgin form, not like how we fry it, but as a salad dressing. So these are all small things of interest, but the most important thing is controlling the amount of grain, improving the amount of vegetable, and yes, it's very important that you never eat to a full. So if you see, there was a very famous BBC series sometime back about the blue zones of the world, where people have higher longevity as compared to the rest of the world. Places like Sardinia in Italy and Okinawa. And the simple thing which they follow is they never eat to their full, they eat to 80% of what they so there is always space for something more, and they do moderate exercise the whole day, and they consume a lot of vegetables and pulses as compared to the grain, and that is why they live longer.
Yes, sir. And when it comes to exercise also, how many people have you seen in your practice that consider exercise as a management for cholesterol when it comes to
people, when we say you need drugs, or even when we say you need lifestyle change, the first thing is, sir, now we'll join the gym today itself. Or like our local patients will say, now gym hogtevi, and they'll say we'll come back in 3 months fit and fine. But the thing is, most people do not know what is the type of exercise that is required, and more importantly, they don't have the time and energy to invest in it. It's just a way of me delaying their drug therapy, and then nothing happens. And I think Dr. Khushboo here is our rehab specialist, and she would be best placed to tell you about what exercise is appropriate. But a small sort of, if you would say, a guideline by the American Heart Association is that they recommend 150 minutes of moderate exercise a week, which can be split. And if heavier exercise means 75 minutes, that is a total number. But what should be there and what is the composition, I think ma'am will be able to guide you better on that.
I think when it comes to cholesterol management or fat reduction, and when we are talking about overweight and all of that, we see the timing when you are doing the exercise. As you know, fat metabolizes the last. So what timing you do the exercises matters, and also what type of training you are doing, and when are you introducing that in your exercise journey also, we focus a lot on that. And if somebody is on statins, off statins, or what type of diet they are following, and are they fasting, are they diabetic, how is their fasting sugar. So all of these things matters when it comes to timing and type of exercises. So I think, like, once your cholesterols are on a higher side and you think that I require exercise or diet, I think again taking a expert advice will be a right choice. Otherwise you will end up into, like, there is many side effect of exercise as well, so you will end up into those and you will not gain the benefit, and then you will think that nothing worked out, and you will feel like a failure. So that shouldn't be the case. So I think, like, taking advice and then going forward will be the right choice, but starting with simple physical activity, as sir mentioned, that and try to also be active, as sir mentioned, that try not to sit for longer. So sedentary time reduction is more important than doing 1-2 hours of exercise in one stretch. So that is more important in when it comes to your carbs and all of that to metabolize. You require to be active rather than doing in one stretch, I feel. So thank you so much, sir, for very wonderful insight on this topic. So as we learn, prevention is a daily habit, not an emergency response. So take your steps today and protect your heart.